everyone. Welcome back to another episode of the 2020 podcast, Canada's #1 optometry podcast. I am your host, Dr. Harbir Sayan. Thank you so much, as always, for taking the time to join me here to learn and to grow. I'm so grateful for all the support. As always, I would make one big request off the top, which is if you get some value from this, please share it. Put a link on LinkedIn, put a screenshot up on Instagram, send a text to your friend, whatever you do, let them know we're having these conversations. I'm very grateful to have two very special guests here. Before I go into introducing the guests, I want to say a big thank you to the CAO for everything they do for the profession, but for hosting Congress here in Halifax and giving us the space to record the podcast here in the Convention Center. It's been an amazing meeting. Halifax is beautiful. I'm so grateful to be here. So thank you, guys. Thank you to CAO. So I have here two special guests, as I mentioned, Dr. Martin Spiro, who is the current outgoing president, so he's president for the next 2 or 3 days. And then to his left, Dr. Allison Scott, the president-elect or incoming president, who's going to take over that role in a few days. So thank you both for being here.
Yeah, thank you for having us.
Such a pleasure to have you.
Yeah, thanks so much for having us back. It's great to be back.
Yes, it's always good. You've got 2 in 1 year. That's pretty good for you.
Yeah,
That's great.
I'm so lucky.
If you missed it, but actually, let's quickly do a quick plug for that one. So Dr. Spiro was on earlier this year, probably about 6 months ago. I had recorded an episode primarily on the topic of scope optimization. Really great interview. So I'd recommend please go back and check that out. I know we've been doing a lot of conversations around scope optimization lately, but there's a reason for it. I think it's one of the most, if not the most important topic for us as a profession, as colleagues across the country. So there's been a lot of interviews actually. So yours, Martin, was part of like 3 or 4 that I did around that time that were longer. Yeah. And then since then, we've recorded 6 or 7 more short ones. 10 to 15 minute snippets from a bunch of different people, from different angles, different perspectives on the topic of scope modernization. So if you haven't listened to those, please go check those out. All right, to you two beautiful people here. Okay, so I think what we want to do is a quick overview of CAO and Congress here in Halifax. Maybe Allison, we'll start with you. If you want to share tell us a little bit about Congress.
So it's exciting. Congress is here in Halifax, July 2nd to the 5th. We have, I think, our largest attended Congress ever, which is amazing. It's fantastic to host it here in Halifax. For those who don't know, I practice in the city. So it's really fantastic to see so many optometrists come to Halifax.
Yeah.
It's a beautiful city. If you haven't been, highly recommend it.
It is beautiful.
And there's been some really great events. So it's a good opportunity to learn. There's some great CE. We've had 3 streams running today, so it's been a really busy day.
Wow.
There's still 2 more days of CE. We have the Opto Fair tomorrow, which is also exciting. But there's also so much opportunity to meet and connect with your friends and your classmates and your colleagues and make new friends and colleagues.
Yeah,
and
absolutely.
So get to share information and talk to other optometrists from across the country. It's a pretty special event.
Yeah, absolutely. That's amazing. This is the highest attendance, and it's all the way in Halifax. I mean, Halifax is, for me, from Vancouver, is about as far as you can go, right, in the same country. So the fact that that many people are here, I think the location adds, it is far for many of us in Canada, but it's so beautiful. It kind of adds to whatever you can see in the background here is limited, but such a beautiful town. So Martin, why don't you, I know last time we did this a couple of years ago, I wanted to just ask the very basic question of what does the CAO do? And I know it sounds kind of silly, but I'd like to just make sure everybody who's listening gets an idea of the importance of our association and what it does for us.
Yeah, thanks for the question. And in addition to hosting these types of events, which bring optometrists from coast to coast together in a place to learn and connect, CAO is really there for all optometry in Canada, supporting our members, elevating the practice. We advocate at a federal level, both to ensure that the public is aware of what we're doing and also decision makers, so that when anybody thinks about eye care or vision care, the first reflex is optometry. So we position ourselves to be that hub in anything in that strategy. And doing so has allowed us to partner with other organizations who see the importance of getting routine and regular eye care. And actually, now we have a national strategy on it that's being led by the Canadian Association of Optometrists.
Yeah, perfect segue. That was going to be my next question. Let's talk about the national strategy, Bill C-284. I hope many of our colleagues across Canada have at least heard of it. But can you share a little bit about what that is and what's going on there? Yes. Either of you, whoever wants to take it.
Yeah, so we have a national strategy now. We lobbied hard to get that passed, and it was passed unanimously at the House and the Senate, and we were very involved in lobbying that. And now the next phase is to establish that strategy, and CAO is there to ensure that key priorities in that bill will come to fruition. Mainly the education of the public on our role, what we do, why what we do is so important, but also educating others, other healthcare providers, general practitioners, pediatricians, pharmacists, and other caregivers, educators, teachers on the role of vision care providers, what to look out for, why it's appropriate to refer. There's other aspects as well, being increased research. Canada, sometimes research in eye care is underfunded. We have two great establishments, University of Montreal, University of Waterloo, with other individuals that are doing amazing research in eye care. And so if we could help support ongoing research in Canada. There's also an aspect to make it easier for us to access medical devices and pharmaceutical products which may be available in other markets. Canada is sometimes a tough market for these companies to bring their devices or medications into because we are small and there's sometimes a barrier. So to smooth out that process so that optometrists and their patients have access to medications and devices that benefit our patients and benefit our practices as well.
That's a lot of stuff. That's excellent. So overall, I mean, it's a big win for optometry, for eye care. To increase awareness in the public, to improve funding and all this kind of stuff. If I understand correctly, there's a timeline once that was passed for that to become what's the right word, to put it into action. So where are we on that timeline?
We're engaged now with government firms to make sure that those key priorities are going to be established. It's a 1.5 year timeline, so we're about 6 months in right now.
Got it.
And then the next stage is to have those ongoing discussions with Health Canada to make sure that that implementation is going to be there and going to be there in the right way.
Excellent.
So
that's amazing. That's the CAO put that forward and advocated for that. So that's really amazing. So what are some of the other things that CAO is advocating for and working on kind of in the general interest for optometry in Canada?
Yeah, that's good. Well, we do have our inaugural leadership boot camp happening in October, and our goal is to help build current leaders, to give them the techniques and the things that they need to lead, and also in the future hope to build our future leaders to make sure that we continue to have fantastic leaders advocating for optometry in Canada. We're having that in October, which is really, really exciting. And one of the other events we always have is the Optometric Leaders Forum, and that's the last couple of years we had focused on AI and teleoptometry. Last year we focused on optimizing scope and really trying to become more aware and learn from some counterparts in the United States, both their wins and their, losses, I guess, or the battles that they've had to deal with, and then also some of the Canadian jurisdictions that have been working on scope and some of the challenges that we've all faced, so that we can all learn together to look at that.
Yeah, absolutely. That was something I think you shared with us in that interview as well. That's really useful.
And the summary is on our website for people to look at as members as well.
Summary from
the Optometry Leaders Forum.
Oh, from OLA. Oh, that's right. Okay. So the one in October, can you repeat that one again? And how do we look into that? Who should be looking into that?
So it's our leadership boot camp. So this year will be our council and provincial presidents hopefully joining us there. And then we're going to still learning how to evolve it. So I see. It is, to hopefully develop future leaders, but I think we're learning how that's going to grow as the more information we get. Sure. So we're doing sort of our first one to see how it goes, and then we'll build from there.
Wonderful. Look forward to hearing more about that. One of the topics that I feel like for most of us as optometrists, as practitioners, that's going to be top of mind probably forever, is reimbursements from various entities, right? So whether that's government reimbursements, so in BC, like MSP, and I know our provincial association, BCDO, is working hard on always moving that forward, but in reimbursements from third parties, from insurance providers, how do we get those companies to see optometry, like the way we always make our analogies to dentistry, right? So how do we get them to see us more like that, where we get more frequent reimbursements or greater reimbursements? Is that something CAO is working on, and how?
Yeah, that's actually one of our key advocacy efforts. When it comes to at a federal level, I'll just come back to the private insurance, but when you ask about what else is CAO doing, at a federal level, as much as a lot of the public coverage is provincial, there are populations that are federally covered. Refugees, Indigenous patients, and military. And so CAO is actively at those discussion tables, and some of these programs are not up to date, don't reflect modern eye care.
I see.
It is in many of the provinces as well and need to be updated. There have been a few great wins. The Department of Defense has increased their reimbursement for optometric exams and simplified the form. NIHB, which covers the Indigenous patients, has made it a little bit more simple and no longer requires pre-authorization for optometrists to see their patients, but we do know there's other challenges there as well. And BC is doing is leading the way on that. And lastly, with refugees, that program is also quite outdated, and we've just submitted an official submission explaining that both the program and the reimbursements don't reflect that.
Okay, good.
On the private side, with employee benefit coverage, vision care, it's the same thing. You know, a modern eye exam is not one exam every 2 years and, you know, maybe an allotment for glasses. Nowadays, optometrists are doing much, much more. Diabetes, glaucoma, vision therapy, specialty lenses, myopia control. You know, there's so many other things that go along with that. And, you know, many patients may need more than just one eye exam every 2 years, partial exams, emergencies. So CAO has an advocacy campaign for private insurance called Don't Lose Sight. Don'tLoseSight.ca is the website.
I like that.
That goes into educating insurers, and both the insurers, providers, the employee groups, and the employers on the benefits of modernizing their eye care. And actually, one of the large Canadian companies this year, Medavie, has adopted programs that align with our recommendations, which now include imaging, partial exams, treatments for vision therapy. And so they've used the CAO recommendations and incorporated that into our plan, into their plans, and we're looking to snowball that and say, hey, one of you guys gets it, so let's modernize at the forefront. So, you know, it's something that a lot of education needs, but we're seeing the fruits bear from that effort as well now.
Yeah, that's amazing. That's really good to hear, because I wouldn't even know how one goes about advocating in that or having that conversation with that industry.
It's about educating, right? And you know, a lot of people really value their eyesight and feel that it's important, but are not completely satisfied with their vision benefits program.
Absolutely.
So they want something that really reflects their needs, and we're there to educate them. We just had a great webinar with over 200 industry representatives that assisted on it, so from the insurance industry on that, and we have people going from province to province. We have champions in each province educating local insurers on the benefits of modernized eye care.
That's excellent. That's excellent. Well, that's really nice to hear, and hopefully our colleagues will be happy to hear that as well. That's hopefully in the relatively near future, greater reimbursements will be available. That's excellent. So that's really wonderful. I think we covered a few really nice, important topics there. What the CAO does, the advocacy, helping support the profession in these different ways. Anything else we want to talk about before we wrap up? The annual report, that's something that you wanted to share, so let's mention that.
Yeah, it's available on the CAO website, so I recommend going to have a look at that. I believe it's also been in the latest edition of Contact, so open your Contact, have a learn. It's the easiest way to kind of learn what CAO is up to. It comes out on a regular basis and certainly has a lot of great information in there.
We'll put a link to that in the notes, show notes, so whether you're watching on YouTube or listening podcast app, it'll be in there, so make sure you click on that. But what kind of stuff would we expect to see in there? What types of details will we learn?
Yeah, so we just touched on a few things here. You know, we're advocating for student loan forgiveness for optometrists that want to practice in rural areas. You know, we talk about our endeavors. You know, we do a lot of work with the schools, University of Montreal, Waterloo, but we do know that a lot of Canadian graduates are studying in the US, so we're very engaged with the schools there and student support in that realm. Just a whole host of stuff that CAO is actively on, advocating for making sure that we get medications, that when drugs are in shortage, that we're signaling that to Health Canada so they could have backup.
Gotcha.
So there's a lot of great work that CAO is doing behind the background to make sure, and you could read all about that, and it's a very nice report, and I hope members enjoy it and you know, get to see all the wonderful things that are happening for optometry in Canada, and it's been a privilege to be a small part of that. So.
Yeah, well, that's great that the report's available, so please do go and check that out there. Well, thank you, Martin, for being the president for the last couple of years and everything that you've done to kind of spearhead and move optometry in the right direction. And Allison, we're very excited to have you at the top and looking forward to seeing you more and everything that comes under your, what's the right term, your term as president? There's going to be a better word than term, like your reign.
No, but it's been great working. I mean, Martin's done a great job for us and representing us for the last 2 years, and so it's been pretty special, and it's been great to work with him. So I look forward. He's taught me a lot. So yeah, I'm looking forward to it. Yeah.
Such a rewarding thing to be able to serve the profession. It's really been a truly rewarding thing, and among that is speaking to people like you who are also championing optometry across Canada. So also once again, just want to send my appreciation for your voice, what you're doing, and having us on once in a while as well. We always
my
really
pleasure.
enjoy it.
My pleasure. Thank you very much. I'm always happy to. The podcast has become well, I'm trying to at least utilize it as a platform for supporting our profession. So anytime I have conversations like this, I'm always happy to do that. So any other final words of wisdom you want to share before we wrap up? Did we miss anything?
I think.
Well, we want to say, this is, like Allison was saying, I'm biased, and maybe I'm allowed to say these things, but I think CAO Congress is one of my favorite optometry education. It's big, it's connected, but it's small enough that you feel that part of that Canadian optometry community.
Right.
So I do want to invite all your listeners,
of course,
if they're not here already, to come to our next CAO Congress in 2027 in Saskatoon in July.
July 2027, Saskatoon. Put it on your calendar. Thank you for remembering that, because that was something I was supposed to mention. CAO is amazing. I was looking back at some stuff, and I realized I've been to 3. I thought at Quebec City and this one, but Victoria back in like 2019. And yes, all 3 meetings have been spectacular. They've been amazing. Now, I am biased, and so my favorite meeting, maybe tied for first, let's say, I gotta be nice, is BCDO. BCDO, it puts on such an amazing conference and such a meet. But of all the other meetings, CAO is the one that is pretty much at the same level, just the quality of education, the quality of the venue, everything that you'd want to get out of a conference, especially if I'm traveling. I'm lucky that BCDO is in my backyard, but if I'm going to travel, I want to come to a place that I get an amazing experience, and CAO always provides that. So definitely to our colleagues who haven't attended CAO, make sure you do attend the next. It's only every 2 years, so you don't want to miss it, otherwise you're going to be like too old. So try to attend next time in Saskatoon. All right, thank you again, guys. I really appreciate your time. And thank you to everybody. Oh, thank you once again to CAO for giving us this space here in the Convention Center to record these podcasts, and as we learn, for everything that CAO does to support our profession and us as optometrists. Thank you to everybody who's listening and watching to the 2020 podcast, Canada's #1 optometry podcast. We'll see you guys in the next episode.